Lonely?
There's nothing lonely about it. Do you know the only emotion I felt this week is relief?
Relief?
Yeah. I better stand by and watch other surgeons make a tournament after cock up at the place.
And now it's your turn.
I've waited long enough for this. Certainly not going to drop the ball now. Right, we have a cardiac tamponade.
I love the smell of betadine in the morning.
Right, let's prepare to open him up, please. No, you don't. You're not dragging me out all this way and dying on my table.
So, what's the vision? What can we expect from Connie Beauchamp's Holby? 4 units of ONAG.
You know my credo, Greg. Right, have you paged the perfusionist? It's really quite simple. Right, charge the D-fib to 100, please. Always be the best. Sylvie, it's me. Can you put it on, please? I can't have missed it. I'm the director of surgery. I need
What, do you think they're going to wait for us? Hold the coffin, Connie's not here yet.
Can you reschedule my mitral valve for 11 and get me a taxi as soon as possible, please? Have you got the results back from the MVP patient?
White blood normal, CRP 10, hemoglobin 12.
Right, let's discharge him. Gracie, it's Mummy. I just want to say sorry I didn't kiss you goodbye before school today. All right, have a lovely day, and I'll see you tonight. I love you too. All right, baby, bye. Actually, when was Moira's last echo? Do you know what? Let's just do another one. Check for leaks. Right, and did someone get me a wreath?
Where were you? Funeral. He's our colleague, our friend.
What was I supposed to do, Elliot? Abandon the patient halfway through a ventricular fibrillation and say, resuscitate yourself.
Listen, Connie, if you're going to be Queen of Holby, you're going to have to learn how to delegate.
Oh, I don't like delegating. It's another word for defeat.
I hope, at the very least, you're going to send an email to your staff to explain why.
Of course I will, if I ever get the chance.
Connie, how long does it take to send an email?
Hey, it's my dad.
Right, what's wrong with him?
He started a relapse earlier, but this pain, it keeps coming and going. I've looked it up on the net and I don't think it's MS.
What kind of MS?
Relapsing remitting. He's had it 15 years.
And Connie Beauchamp, your son says you're in pain?
I'm fine. Will you tell him to stop fussing?
Pulse is very strong.
Yeah, I know. Like I told you.
Oh,
You're fine, are you?
all right, so I've got a bit of a bellyache. It's not going to kill me, is it?
Let's do the usual bloods, plus echo, ECG and cardiac enzymes. And let's give him 2.5 milligrams of dimorphine for the pain. All right, thank you.
What, that's it?
Sorry, what did you expect?
Well, for you to help him.
Well, I will do, but I have to find out what's wrong with him first, don't I?
Now, your staff appear to have a somewhat lax attitude towards punctuality.
There's been a funeral.
Lyndon Cullen, I'm aware.
It overran.
An excuse is an admission of failure.
I'm not making excuses.
I would be. I'd be wanting to explain why 15 members of my staff have been AWOL for the last hour and a half.
17.
Of course, let's not forget the 2 porters who spotted an opportunity to skive.
Mr. Cullen was a popular member of staff.
They always are. You seldom read a scathing obituary, do you?
I don't mean to be rude, but who are you and what are you doing in my office?
They haven't told you yet.
Told me what?
Basically, because of the negotiations involved, we've had to play our cards pretty close to our chests.
So you've known for a while?
No, I wouldn't say a while, exactly. I mean, Michael only stood down, what, a week ago?
And it never occurred to you to just have one director of surgery?
It was certainly something we looked into, but actually what we learned from the Rick-Michael
Debacle?
tenure, having 2 heads benefits both parties.
It is an enormous workload for one person.
I've been coping.
We just thought it would be someone to back you up. And you have different, I'd say, complementary skills.
Such as?
His great strength is he is incredible on the details. You only have to look at his track record.
Oh, I have. Makes for impressive reading. The youngest surgeon to be made consultant in the last 25 years. 2 hospitals to Foundation Trust status. Kind of makes you wonder what he's doing here.
He's here because he wants to work with us. With you.
And my presentation to the board on Thursday, I assume that's going ahead.
Of course.
Mr. Hanson is a facilitator. He is not here to tread on your toes. He is here to support your vision, as we all are.
I only want what's best for the hospital. You know me. It's all I've ever wanted.
No, sis. It wasn't long after Dylan was born. No, I swore to myself that life would go on as normal, and it has. I mean, we have a totally normal life.
Yeah, except he's your carer.
No. He's not. That's not how it is. I don't need I'm not disabled or nothing. I mean, we just look after each other like any father and son.
Sorry it took ages. Couldn't find a straw.
Oh, Dylan, it's all right.
So, you worked out what's wrong with him yet?
Well, there are a few possibilities, but we're still monitoring your father to see how he reacts to the blood pressure drugs, and if necessary, we'll do a repeat echo to see if there's been any change.
That's it?
Well, for now, it's just a case of wait and see.
That's all you've got? Wait and see?
Dylan.
We've been here 2 days already. What are we supposed to do with that?
Where are you taking my patient?
Keller,
What?
he needs an ultrasound.
You can have an ultrasound here.
There seems little point in taking up one of your expensive CT beds when his problem's clearly GS-related.
Well, I disagree. The pain's in his chest and the echo shows dilated aorta.
Yes, but he has severe abdominal pain. So what's your diagnosis?
Well, he doesn't have established ischemic heart disease.
So your diagnosis would be...
Well, I'm still working on his blood pressure.
Your diagnosis, Mrs. Beauchamp? And the patient was admitted almost 36 hours ago. No diagnosis yet. A change of tack, surely?
Here at Holby, we don't go around stealing the other consultants' patients. It's just not done.
But we're joint directors of surgery, aren't we?
Yes, but...
So Mr. Brenton would be our patient, surely?
Absolutely. Your BP is constantly going from high to normal. Now, the pain, is it constant? Is it on and off?
Look, I really don't want to be rude, love, but you can do 400 more tests if you like. And you're not going to tell me anything I don't already know. I've lived with this condition for 15 years now. I've always known what could happen.
Right, Donna, let's do blood cultures and repeat echo.
Why won't you listen to me? You're wasting your time.
Oh, hi. 10:30, you know. Oh, you must have put about 200 hours into that presentation. Thought you'd have finished it by now.
I have.
So what are you still doing here? Go home.
Elliot, I have run bloods, echo, angiogram, ECG, cardiac enzymes, CRP, ultrasound. I mean, what am I missing?
Connie,
No, I won't let him win this. I refuse to let him win this.
Connie, when was the last time you were home in time to say goodnight to Grace?
Do you know what? My nanny earns twice what our nurses do. It's about time I got my money's worth.
You know, you'll wake up one day and she'll be 18 and you'll have missed it. The best years. The magic years. And she'll want to know where you were. What'll you tell her? Go home, Connie.
I'll tell you what's wrong with you.
There's no need, Doc. Really.
Sorry?
Catecholamines. I've explained it all to Mr. Brenton. It's blindingly obvious, really, when you think about it. I feel a little ashamed, don't you? Pheochromocytoma. Textbook.
Of course.
So, what can you do? What's the treatment?
Well,
There's a procedure.
Mr. Hanson, can I have a word, please?
One moment, Mrs. Beauchamp, please. We've a slot in theatre this morning. We can call your son.
No. Don't. Not till after, if that's all right.
Yes, you must be so proud of your son, turning down a chance to go to university just to look after you. Smart move.
University? Or Dill? I don't think so. I mean, Dylan's not the sharpest pencil in the box. He takes after his father in that respect. And he says his grades are lousy.
I'm not convinced your son's been telling you the whole truth.
Mr. Hanson, if you wouldn't mind, is he even fit for surgery?
The neuro and physio specialists seem to think so. Mr. Griffin, perfect timing. You could be arbitrator.
For what?
Pheochromocytoma on the adrenal gland, which has attached itself to the diaphragm. It's there.
Uh-huh.
Mrs. Beauchamp wants to do keyhole through the chest.
Whereas Mr. Hanson wants to slice and dice, despite the fact the patient has MS.
Well, if this were my patient, given the position of the tumour, I would suggest that you and I operated together.
Well, that's our answer. A CTGS collaboration, except, of course, unfortunately, you're currently off games, so I'll have to take your place. See you on the ice.
Sort of upgrading to cardiothoracics.
Upgrading? Why do so many CT surgeons have this delusional God complex?
The heart is a major organ in the body, ergo.
The heart likes to think it's the body's major organ, while the kidneys just get quietly on with their work, filtering out poison, allowing the body to function at its maximum capability. They're efficient, beautifully designed, and they don't have to shout about it.
But you can lose a kidney if the heart stops beating.
Hack off a piece of kidney, it'll just grow back, whereas once the heart's kaput, just a useless lump of tissue. And of course you can replace a faulty heart with a machine the size of a cigarette packet. A bolus of phenoxybenzamine, please.
We need to keep moving.
Scissors?
It wasn't supposed to happen like this.
Might have been an idea to decrease the sodium nitroprusside.
Let's have a litre of Jello. If we'd have gone with keyhole procedure.
Which we didn't, and start the dopamine, so I fail to see the usefulness of that comment.
All right. Cortex patch 3-proline.
There we are.
If we lose this patient, I'm holding you fully responsible.
If we don't, presumably you'll take all of the credit. BP's climbing again.
Right, once this is in, let's get ready to close up.
Scalpel.
Now's not a good time. For Holby City General uses the Gibson Endowment to make us one of the most progressive and forward-thinking units of its kind in Europe. Now I know I can rely on your support. You know me, you know how I operate, and you can trust me to deliver. Okay, thank you.
I don't know if anybody's got any questions.
Actually, I'd like to ask something, if I may.
Oh, Mr. Hanson.
I think your vision is wonderful. I think it's utopian. I think the only thing missing, really, is a river of honey and unicorns cavorting wildly through the hospital grounds.
Actually, Mr. Hanson, it's a fully working, fully costed proposal.
Yes, for a hospital that hasn't taken $1.5 million brokerage in working capital from the SHA to plug their deficit. Or perhaps in a year where the Department of Health hasn't reduced tariff by 3%. I mean, if this was 1994, then I'd say bring it on, but after all, who couldn't use another MRI scanner? Actually, I'll tell you who. Us. This hospital already owns 2 fully functioning MRIs, the last of which was only delivered in November last year. But that's not the point, is it? The point is that this vision of yours isn't really a vision for Holby at all. It's a vision for Darwin Ward, for Connie Beauchamp. It's a work of utter solipsism, not to mention naivety. I'm sorry, but perhaps we should have collaborated on this, and then we wouldn't have wasted everyone's time.
You let me believe that this was all part of your ingenious management strategy, and all the time you knew you had no choice. You're just a puppet, Mark. They think of you as a nurse in a cheap suit.
Have you any idea just how much trouble we are in?
Well, after yesterday's meeting, I've got a good idea.
We are hanging on by the skin of our teeth.
The SHA gave us an ultimatum. Either we accept their choice for joint DOS and embark on a process of efficiencies,
Or, Mark.
or we close half our wards, including Darwin.
Merge them with St. James's.
They couldn't.
They could. This has come from the top, the very top.
Why him?
He's the best there is. And as far as the SHA is concerned, you're an unknown quantity.
But I have been a consultant for 10 years. I've been medical director, I've been...
director of surgery for 11 days.
And what if I can't work with him?
Connie, whatever you or I might think of Mr. Hansen, he's going nowhere. He's here to stay. Question is, are you?
Hi, are you listening?
Is this going to be a bloodbath?
Define your terms.
Percentage of staff.
5. Possibly more.
Names?
Not yet.
And how do you propose avoiding a mutiny?
Day 1 of surgical training. If you want to avoid scarring, you have to wield your scalpel cleanly, boldly, without hesitation.
I hope to God you know what you're doing.
I don't believe a hospital is defined by its leadership. A hospital is only as good as its weakest link. Our job is to seek out the weakest links and fix them.
Connie and I are delighted to welcome Mr. Henrik Hansen to Holby City.
Most of you are intelligent people. You read the newspapers. You're aware that we're in the middle of a sea change. We can't afford to bury our heads in the sand any longer. As director of surgery, I will always tell you the truth. And the truth is that there are going to be some tough times ahead, some tough decisions will have to be made. Some people will be losing their jobs. As the first step towards getting the hospital back on track, Mr. Spence has volunteered to be the new consultant on AAU, taking the place of the late Mr. Cullen. Leaving the past behind is difficult. It can be bewildering, frightening even, but it's also vital. It's what keeps us alive. So we must look to the future. We must move forwards. It isn't going to be easy, but it's time for a change.